When I first found out about the underserved medicine opportunity for Blue Cross, it interested me, and I initially thought rural medicine, just because I was willing to work wherever I needed to work, and found out that we could also expand it to the urban underserved, which was really interesting to me. I grew up in the city of Birmingham. I grew up with folks who didn't have anything, didn't have access to resources, and so the idea of being able to take care of them as a physician was really interesting to me.
Years ago, we realized here at Blue Cross Blue Shield that the best way for a population to be healthy is to have a primary care physician who took care of them. The primary care field is I don't want to say looked down on, but it's sort of cooler to be a specialist. And because it's cooler to be a specialist and they tend to make a little more money, you tend to find plenty of physicians not choosing to be a primary care doctor. They want to be a specialist somewhere. And that's led to a shortage of them. And the shortage is not just in the big cities. It's most acute in the rural areas, but there's still not enough of them in the cities as well.
We have tremendous healthcare resources in Birmingham, but there are also a lot of people in this community that don't have access to care, that don't have a good primary physician that they can see about their daily needs.
So we created this program called Primary Care Select. The goal of it was to make it much more cool to be a primary care doctor. It has a number of parts to it. We started off by saying, look, we'll pay you more. If you will join this program, your base fee schedule goes up. And then because we know you are a good physician and you want to take good care of your patients, you know what? If you do those things that show you're delivering better care and or you're doing it at a cost-effective standpoint, we'll pay you more for that as well. So one of the things that we're the most proud of is our scholarship program. We have fronted the money for potential of up to 150 physicians and said, if you will go into a primary care field in a non-metropolitan area for 3 years, then we will pay for your last 2 years of medical school. We're about halfway through that program. It's been very successful. We're working with all 4 medical schools in the state. And again, when we finally finish, there will be approximately 150 extra physicians working in rural Alabama. And to give you an idea of the impact of that, when you look at all the primary care docs in the state, there's about 2,000 of them. 900 or so of them are in these rural areas. So if you add 150 to 900, that's a significant increase in the number of physicians in rural Alabama.
And so this program allows us to impact a larger portion of the community, both in the urban setting, also in the rural setting, where we can bring people in who think it's too expensive to see a doctor. I'll just have to deal with what I have. But providing opportunities for physicians to reach out to that population is tremendous. There is still a great need that as we continue to grow and as we continue to multiply, we still cannot take care of everybody. And so the more people who are involved, the more people who make the choice to get involved, the better it's going to be.
So we're excited about this program. It's been very successful so far. The students that have gone through have enjoyed it, and some of them are actually going into practice now, and we think it's going to be great as the rest of them go out there in the rural world.